It's Patrick Hutzel from IntensiveCareHotline.com, where we instantly improve the lives for families of critically ill patients in intensive care so that you can make informed decisions, have peace of mind, real power, real control, and so that you can influence decision making fast, even if you're not a doctor or a nurse in intensive care. This is another episode of Your Questions Answered. And in last week's episode, I answered another frequently asked question from our readers. And the question last week was, how long does a critically ill patient stay on a ventilator after open heart surgery? You can check out the answer to last week's question by clicking on the link below this video. In this week's episode of Your Questions Answered, I want to answer another question from one of our readers. And the question this week is part 5 of my 57-year-old dad has been in intensive care with cardiomyopathy and pneumonia for 5 weeks. He's still in an induced coma and still doesn't have a tracheostomy. Help. This series of questions from Gary are excerpts from numerous one-on-one phone and email counseling and consulting sessions with me over a 2-month period. Previous questions from Gary you can also access below this video, part 1, part 2, part 3, and part 4. I put links to those questions. Gary and his family went through many challenges while his dad was in intensive care, and I felt very privileged helping Gary through this difficult time in his dad's life. So, Gary writes, "Hi Patrick, it's been another hectic day. I couldn't get hold of the consultant today. He was on call in another hospital. I asked one of the junior doctors to clarify the withdrawal of treatment situation, to which I was told that is not the case. My dad is still apparently being treated medically, even though he's not on dialysis for his failing kidneys. They are telling me that he's getting Lasix to keep improving his urine output. They have, however, assured me that he will get dialysis if the Lasix isn't having the desired effect. Today, my dad is down to 50% oxygen and is now on noradrenaline. Is that a type of inotrope? After a bit of Google search, it seems that it's given in cases of low blood pressure. His infection markers in his blood are down a bit as well today. He is, on the whole, much the same with a slight improvement compared to yesterday. I spoke to a very helpful nurse who's now helping me with a request for his medical records, but that could take days, she said. I have provisionally booked a time with a consultant next Tuesday at 12:30 p.m. Can you be available then to call in? I'll provide further details at that point. I also found out that a cardiologist had been consulted on my dad's case, and by that I mean never visited him, only reviewed his echo and his ejection fraction. My next step is to try and contact him to see how he reached his treatment decision and why he hasn't done anything else. Thanks again for everything so far, and we talk tomorrow. From Gary." So here is my response. Hi Gary, I can certainly be available on Tuesday at 12:30 p.m. to speak with a consultant. You see, now it's confirmed what I always suspected, that he's working somewhere else, and that this ICU and their patients may not even be his priority. And again, Gary, a 3-bed ICU doesn't really warrant a full-time consultant anyway. Very, very rarely would they treat somebody as sick as your dad, and neither should they. Smaller ICUs are usually there to establish first-line and baseline treatment for critically ill patients before they can be referred and moved to bigger, better equipped and resourced, and simply more experienced ICUs where they have all the options available that should have been available to your dad when he first got diagnosed with the cardiomyopathy. As far as I understand from what you've been telling me, they are not withdrawing treatment yet. However, wanting to issue a do not resuscitate or a not for resuscitation order is usually the first step, almost leading up to it. One of their next steps may also be to limit the amount of dobutamine and the amount of noradrenaline they are giving, as well as limiting the oxygen on the ventilator. That's why they've also mentioned a few days ago that your dad wouldn't be a candidate for dialysis. In essence, inotropes or vasopressors and ventilation as well as the tracheostomy are constant life support. Without it, your dad couldn't stay alive at this point in time. Again, Gary, the end goal for any patient in intensive care is to get them off life support as soon as possible. But in your dad's case, they've missed the boat early on by not referring him to another ICU that would have had all the treatment options available to him, like ECMO, VAD, or heart transplant. It's certainly a positive sign that he's down to 50% oxygen on the ventilator, and that's probably due to the IV antibiotics working. He's probably also getting high doses of dobutamine and noradrenaline, as well as the furosemide and the Lasix for increased urine output. And yes, Gary, the noradrenaline is an inotrope or vasopressor given for low blood pressure. In essence, the way noradrenaline works, it's a vasoconstrictor, constricting the blood vessels and therefore concentrating more blood towards the heart and therefore increasing blood pressure. Dobutamine is an inotrope given for a weak heart, and it improves the contractility, the pump function of the heart. It also decreases peripheral vascular resistance, or also known as afterload, so that the heart can pump blood against lesser resistance in the blood vessels. Therefore, high doses of dobutamine also lower the vascular resistance in the veins and arteries, eventually lowering the blood pressure. Therefore, the noradrenaline, which is again a vasoconstrictor and is in essence constricting veins and arteries in the peripheries, and therefore is centralizing blood flow towards the heart and hence increasing blood pressure. Both drugs, dobutamine and noradrenaline, are having some synergies when they work together. I'm sure your dad would have been on noradrenaline before at some stage. It's also a sign that your dad may still be having sepsis, even though his infection markers may have come down. It's also good to hear that the oxygen is down on the ventilator to 50%. Again, maybe a sign that the chest is improving for now with the inotropes as well as the Lasix to increase urine output. Now, the next steps really are to make sure that they continue to do everything within their power to keep your dad alive. Even though your dad's situation hasn't improved much, it's way too early to give up on him, and it's good that you've made that very clear to them and that you expect that. If I was you, Gary, I would still try and get him to another ICU, where they are used in dealing with such sick patients. For now, make sure that there are no treatment limitations and that you don't agree to any treatment limitations. Next steps are to make sure that if your dad's kidneys continue to deteriorate, that they are commencing him on the dialysis machine. Furthermore, given that you've had such bad experience with meetings with the consultants, make sure you don't go into any meetings before we've spoken again. We will discuss in detail how you should go into any other meeting with the intensive care team so that you are prepared. Definitely try and contact the cardiologist. It's always good to speak to other people, even though it's most likely that you won't get many news from him. Again, given that the ICU team has only consulted the cardiologist once and not spoken to him again since, shows how amateurish and negligent they really are. In cases of severe cardiomyopathy, a cardiologist should be consulted all throughout the ICU stay. Again, you'll find that in smaller hospitals, consultants have other jobs in bigger hospitals, and looking after patients in a 3-bed ICU is a side gig for them, and patients and families suffer because of it. I also agree with you that you should request the medical records for your dad so that we can look at what happened in the early days of his ICU admission. Also, keep looking about getting a second opinion. Also, besides the consultant you are referring to, are there any other consultants that you've dealt with who seem more competent and also more approachable? We'll talk tomorrow. So, how can you become the best advocate for your critically ill loved one, make informed decisions, get peace of mind, control, power and influence quickly whilst your loved one is critically ill in intensive care? You get to that all-important feeling of making informed decisions, get peace of mind, control, power and influence when you download your free Instant Impact Report now by entering your email below. In your free Instant Impact Report, you learn quickly how to make informed decisions, get peace of mind, real power and real control, and how you can influence decision making fast whilst your loved one is critically ill in intensive care. Your free Instant Impact Report gives you in-depth insight that you must know whilst your loved one is critically ill or is even dying in intensive care. Sign up and download your free Instant Impact Report now by entering your email below. In your free Instant Impact Report, you learn how to speak the secret intensive care language so that the doctors and the nurses know straight away that you are an insider and that you know and understand what's really happening in intensive care. In your free report, you will also discover how to ask the doctors and the nurses the right questions, discover the many competing interests in intensive care and how your critically ill loved one's treatment may depend on those competing interests, how to eliminate fear, frustration, stress, struggle, and vulnerability even if your loved one is dying. You get 5 mind-blowing tips and strategies helping you to get on the right path to making informed decisions, get peace of mind, control, power, and influence in your situation. You'll get real-world examples that you can easily adapt to your and your critically ill loved one's situation. How to stop being intimidated by the intensive care team and how you will be seen as equals. You'll get crucial behind-the-scenes insight so that you know and understand what's really happening in intensive care and how you need to manage doctors and nurses in intensive care, and it's not what you think. Thank you for tuning into this week's Your Questions Answered episode, and I'll see you again next week in another update. Make sure you also check out our blog section for more tips and strategies, or simply send me an email to support@intensivecarehotline.com with your questions. Or you can call me, find international phone numbers on our contacts tab. Also, check out our ebook section where you get more ebooks, videos and audio recordings, and where you can also get one-on-one counseling and consulting with me via Skype, over the phone or via email by clicking on the products tab. This is Patrick Hutzel from intensivecarehotline.com, and I'll see you again next week in another update.